So Dr. A back, Unit 5, the female and the male reproductive system. So what we're looking at as far as the female reproductive system is to name and locate a lot of the female reproductive organs, learn their combining forms, which you'll see in the audio lectures. We're going to look at how these organs and their hormones function in the process of menstruation and pregnancy for the female reproductive system, and identify a lot of different abnormal conditions associated with the female reproductive system and some of the abnormal conditions of newborns. Also, some medical terms that are used in medical reports and records concerning the female reproductive system. So I think it's fair to start by understanding what sexual reproduction is, and that's the union of an ovum and a sperm cell. And we know that when an ovum and a sperm cell meet, they're called gametes. Okay, and each gamete contains half the number of the chromosomes of a normal body cell. So we have 46 chromosomes, 23 pairs, which is 46 in total. Now, when we say the gametes, we say the female and the male gametes, which are the ovum and the sperm cell. Gametes are produced in the gonads. The female gonad, which is the main organ of the female reproductive system, is the ovaries. The male gonad would be the testes. So the term gonads is used for both the female and the male reproductive system. Fertilization. An ovum leaves the ovary, travels through the fallopian tubes. From there, fertilization takes place if the sperm cells are present and unite with the ovum. The fertilized egg implants. It divides to form a ball of cells. We call that a zygote. Okay, and later an embryo, and then a fetus. Make sure you know that order. There are some images in Chapter 8, the female reproductive system, where you can label, and you'll see the labeling images, the label diagram images of the organs of the female reproductive system. It is important to know the anatomy of the female as well as the male reproductive system and being able to identify. Okay, some of the key components when it comes to the female reproductive system include menstruation and pregnancy. So when we look at the menstrual cycle, it's important to understand the days. So day 1 through 5, the blood cells, the endometrial cells, and the glandular secretions discharge from the body. When you look at day 6 through 12, the estrogen aid repairs the endometrium. The ovum grows into a follicle, days 13 and 14. The egg leaves the ovary and passes through the fallopian tube, and then days 15 through 28, the corpus luteum secretes a hormone called progesterone. The uterus then starts to, the uterine lining starts to build up. And again, there is a nice graphic representation of that according to those days. So that's very, very important to understand that breakdown as far as the days are concerned. Now, when it comes to pregnancy, fertilization happens. The egg implants in the uterine endometrium. The placenta forms, attaches to the wall of the uterus, and the amnion holds the fetus in the amniotic cavity. And we know that nutrients, oxygen, waste exchange between the fetus and the mother, that's where that takes place. And the placenta does form that hormone called HCG, which is human chorionic gonadotropin hormone. So make sure you understand how the implantation in the uterus takes place, the relationship between the embryo to the placenta. Okay, so as well, it's also important to understand some of the phases of labor, the 3 phases of labor. So you might want to look at that as well. Now, the hormones and the hormonal interaction. Now, we know that when we're dealing with the female and the male reproductive system, we're talking about our gonadotropin releasing hormones, or gonadotropic hormones. Now, those are hormones that are released by the pituitary gland, the anterior pituitary gland. The 2 hormones of concern are FSH and LH. FSH is follicle stimulating hormone. LH is luteinizing hormone. Now, those 2 hormones are important in both the male and the female reproductive system, and they're very important in the maintenance of the male and the female gonads. Taking that one step further, some of the hormonal interactions like menopause, or the gradual ending of the menstrual cycle. That usually begins between the age of 45 and 55. There is a gap, so it is very important to understand. A lot of factors play into that as far as, alcohol, drug use, tobacco history, and obviously women who undergo menopause, their estrogen levels start to fall. Option for estrogen replacement therapy, that's a lot of careful consideration is taking because it is a high risk therapy sometimes, but it all depends on the patient. Some of the pathology or some of the medical conditions associated with the female reproductive system, cervical cancer or carcinoma of the cervix, malignant cells that undergo rapid mitosis within the cervix, cervicitis or inflammation of the cervix, carcinoma of the endometrium or endometrial cancer, malignant tumor of the uterine lining, and endometriosis, where the endometrial tissue is usually located outside of the uterus. Fibroids is something very common. That's a benign tumor of the uterus, and there are images in your textbook that show you where fibroids are located and how they look. Breast cancer or carcinoma of the breast, fibrocystic disease, other pathology-associated gynecological conditions in the female reproductive system. Male reproductive system, it's fair to start with understanding the male sex cell, which we call spermatozoa, or the sperm cell, and we know that the sperm cell carries all the hereditary material or chromosomes in the head region. The tail is made up of flagellum or flagella, which makes the sperm cell mobile. Only one spermatozoa out of 300 million sperms released during ejaculation can fertilize a single female gamete or a single female ovum. If more than one egg is present in the fallopian tubes during ejaculation, multiple fertilizations can occur. Now, we know that twins that resulting from fertilization of separate ova by separate sperm cells, we call those fraternal twins. And twins that result from a fertilization of a single egg cell by a single sperm are called identical twins. So the organ of the male reproductive system, they're designed to produce or release billions of sperm cells throughout the man's life. And we know that the man can continually produce sperm. Sperm counts decrease as the male gets older. But we know that the hormone called testosterone is responsible for the male secondary sexual characteristics like a beard, pubic hair, and deeper voice. Now, just like the female reproductive system, the male reproductive system, we do have images in which you can identify or be familiar or familiarize yourself with the different male reproductive organs internally and externally. So it's very important that you understand the anatomy of the male reproductive system. Now, going into some of the diseases associated with the male reproductive system, starting with STDs, some of the most common STDs that are common in females as well, chlamydia, gonorrhea, herpes genitalis, HPV, better known as the human papilloma virus, and syphilis. These are some of the very common pathology-associated diseases of the male as well as the female reproductive system. And let's not forget the make sure you go into the audio lectures for each individual unit, listening to a lot of the key terms, prefixes, suffixes, combining vowels for that unit.